Well, welcome. My name is Dr. David Amron. I was just on Home and Family talking about lipedema, and I wanted to bring up a couple points I never got a chance to mention there. In terms of how it presents lipedema, many times it'll present in the teen years, around puberty or thereafter. There commonly is a genetic component to it, so many times it does run in families, lipedema. And early on, there is disproportion that is evident, commonly in the legs, the calves and ankles, the anterior thighs, the knee area. Many times in its later stages, it involves the arms too. There's not only the fat disproportion, but the swelling that goes along with it too. And then later on, you'll start to feel some numbness, heaviness, even pain, and it'll affect your mobility. It's definitely very underdiagnosed. It absolutely is a specific condition. I've done liposuction for 20 years and specialized in this field, and I do believe it absolutely is a different special condition. In terms of treatment, there's been a lot of things tried medically and this and that, but really the only effective treatment is well done liposculpture and liposuction to remove that layer of fat, and then along with it the edema improves also. It is important afterwards to do proper care and compression stockings and then get back into a good exercise routine. But the liposuction itself, I got to tell you, it is a very specific surgery. These are very complicated areas to do, the calves and ankles circumferentially, the thigh area all the way around. I have a very specific way I go about doing this under local anesthesia called tumescent liposuction, where the patient is conscious and awake to be able to move around. And I contour the area three-dimensionally all the way around to get that type of improvement in Yasna's case and have it sculpt the leg all the way down. It is also a permanent cure in those areas. It will not come back like in Yasna's case. So it's a very interesting disease, lipedema, and I'm so happy to be involved in this condition and to treat it and to help cure it and make the difference in somebody's life, not only in terms of how they look better, but how they feel better too, like in Yasna's case. For more information about this, I've got a site, amronmd.com, amronmd.com, and it goes through a lot of information about my whole approach with liposculpture surgery, and there's whole areas about lipedema specifically. You can contact my office, there's contact information there, and talk to my coordinator. You can also send in photographs through the website that I can evaluate and make a determination in terms of the proper approach in your case.